It is time for the people to stop living in fear of losing their medical coverage, and to live in fear that they're literally one long hospital stay away from having to file personal bankruptcy. It is time for all of us with coverage to stop being forced to pay twice, to pay for ourselves and also to pay for the uninsured. It is time for the hardworking California families and business to get relief from double-digit premium hikes and healthcare costs that are spiraling out of control.
In the course of the negotiations, this wasn't an easy agreement to negotiate. Otherwise, in the last 90 years, you would have seen some successful attempts at really fundamentally reforming our broken healthcare system, not only here in California, but around the country. And the reason why it has been difficult is that it's very tough to get people to the table that have a different point of view to come together and to forge a compromise. But I've always said that the art of compromise is the art of the possible.
Today, California took a giant step towards assisting the growing number of hard-working, tax-paying, middle-class families, too many whose only health care plan is a prayer that they won't get sick, whose only doctor is an emergency room, and whose only realistic chance to live free of both increasing health care costs and being an illness away from financial disaster is the plan that the Assembly just passed along with the governor's leadership. And it's precedent-setting because California, the most populous state and diverse state in the nation, can make health care happen, can show this country that it can be done. The one single, repeated, proven lesson of health care reform that we've learned, as the governor said, for decade after decade, is the longer we wait, the worse it gets. Waiting is just not an option for too many Californians. Today, California started building a new road to reform that I believe history will show that California was the tipping point in the long-sought dream of America, where every single man, woman, and child who works has a choice of secure and affordable and quality health care plans for themselves and their families.